As Omicron fades, medical experts and politicians nationwide are reconsidering masking requirements and COVID restrictions. But some of them are clashing over the best path forward. It's a great opportunity to check in with Dr. David Agus. Dr. Agus, thank you so much for making some time for us. So, on the one hand, the number of cases continues to go down, which is great. On the other, 99% of the country still has high transmission rates. So some states are already loosening restrictions, but the CDC is not budging on their recommendations. What should someone do if their state leaders are telling them something different than the CDC?
Well, the key thing now is not just transmission rate, it's hospitalization rate. And so when there is adequate space in the hospital, when we have oral drugs like the Pfizer drug and the monoclonal antibodies that work, we can lower mask mandates and go back to a new normal. The key is it's different all across the country depending on what city you live in. But transmission rates are not the only metric now.
Given how many states are now doing their own thing, do you think that puts pressure on the CDC to change federal guidelines at all?
Yeah, it's difficult at the CDC because there's not going to be one size fits all. What the CDC needs to do is set parameters. If you have this many hospital beds vacant, then it's okay to go to these restrictions. And if case numbers are X, then you can go to Y. So it's going to be different depending on where you live, and it's not going to be one size fits all from the CDC.
And one big game changer we've been talking about is the vaccine for kids under the age of 5. But on Friday, the FDA came out and said they need more data. They want to see how 3 doses of the Pfizer vaccine would impact a child before making any decisions. Why is that, and how could that impact the timeline?
Well, the 2-dose vaccine had benefit. Clearly, it blocked some serious illness, but the 3 is better. You get better correlates of immunity. So that 3-dose data should be complete in the next several weeks and then filed. And I think that what the FDA wanted was to have one package, that do it once and get it so parents understood that the data were meaningful, that the vaccine was safe, and that it worked. And that will be the 3-dose shot. And hopefully that happens toward the end of March, beginning of April.
All right, Dr. David Agus, thank you.